Welcome to the Dr. Washpain's podcast. My name is Dr. Akash Sehgal. We're going to be continuing our podcast episode on osteoporosis. Without any further ado, let's dive in. So, next up is physical activity, but not just any exercise. To maintain appropriate bone health, we need weight bearing exercises, activities that force your body to work against gravity, helping to stimulate bone formation. Weight bearing exercises include walking, hiking, jogging, running, even dancing and climbing stairs. All of these activities create small stresses on the bones, encouraging the body to lay down more bone tissue to strengthen them. Resistance training with weights is another fantastic way to improve bone density, particularly in the hips and spine. Aim for at least 150 minutes of moderate intensity physical activity per week. But even small, consistent amounts of movement can significantly contribute to better bone health. Two critical lifestyle factors often get overlooked when we talk about bone health: smoking and alcohol consumption. Smoking is directly toxic to bones. It affects osteoblasts, the cells which are responsible for building new bone. Smokers are at a higher risk for fractures and have slower recovery rates when fractures do occur. Quitting smoking even later in life can still help reduce this risk. Alcohol, on the other hand, can interfere with the body's ability to absorb calcium and vitamin D. Chronic heavy drinking is particularly harmful as it inhibits bone formation and accelerates bone loss. The whole notion of 2 drinks a day, be it wine or any other form of hard liquor or aerated beer, is absolutely false. It will not help your heart or your bones in any particular manner. Body weight management is something that we all need to be mindful about. Interestingly, both low body weight and high body weight can negatively impact bone health. Being underweight, particularly with a body mass index or BMI of less than 18.5, can increase the risk of bone fractures. This is because lower body weight is often associated with lower bone mass, reducing the strength of the bones. On the flip side, obesity can also pose risks. While higher weight sometimes correlates with higher bone density, obesity is often associated with a higher likelihood of falling, which can lead to fractures. Additionally, excess body weight can increase stress on bones like the hips, the knees, potentially leading to joint issues and bone weakening over time. One of the most critical aspects of managing osteoporosis is fall prevention. Since osteoporosis weakens the bones, even a minor fall can lead to serious fractures, especially in the spine, hips, wrist, or your arms, even. Preventing falls starts with a comprehensive home safety assessment. A healthcare professional, often an occupational therapist, can help identify potential hazards in the home. Things like loose carpets, poor lighting, cluttered hallways. Installing handrails or railings, grab bars, non slip mats in bathrooms, stairways, kitchens are small adjustments that can have a big impact on safety. But fall prevention is not just about the home environment. It is also about improving personal strength and balance through exercises like yoga or balance training, which can help reduce the risk of falls significantly. But fall prevention isn't just about the home environment. It is also about improving personal strength and balance through exercises like yoga or balance training, which can help reduce the risk of falls significantly. Most fractures caused by osteoporosis occur as a result of fall, particularly in the elderly. Reducing the risk of falling is one of the most important aspects of preventing osteoporosis related fractures. At home, you can install grab bars in the bathroom and stairways. Make sure the light is adequate throughout the house, especially in hallways and near stairways. Declutter your living space. Keep frequently used items within easy reach. Consider removing or secure your carpets and your electrical wires. They can cause you to trip. In public, wear well fitting shoes with non slip soles. Use railings when available, especially on stairs and escalators, and be cautious on wet or uneven surfaces. These simple changes can go a long way in preventing falls and maintaining mobility as we age. These preventive strategies, from dietary habits to physical activity and fall prevention, are key to building and maintaining strong bones at any age. The earlier we start prioritizing bone health, the better prepared we are to face the natural declines in bone density that come with aging. But even if you're starting later in life, it is never too late to protect your bones. Small changes can make a huge difference, reducing your risk of fractures and preserving your independence. Let's talk about medical treatments and interventions available to manage osteoporosis and support bone health when preventive strategies alone are not enough. Now, when it comes to osteoporosis, early diagnosis can help prevent complications, but sometimes, even with the best preventive strategies, additional treatment options become necessary. These treatments aim to slow bone loss, improve bone density, and reduce the risk of fractures. We're going to be discussing some pharmacological and non pharmacological treatments, as well as how to manage the psychological impact of living with osteoporosis. Let's begin with pharmacological treatments. Medications for osteoporosis are primarily designed to either reduce bone loss or stimulate bone formation. They work by inhibiting bone resorption or the breaking down of bone or enhancing bone building. One of the most commonly prescribed classes of drugs for osteoporosis is bisphosphonates. Bisphosphonates such as alendronate and risedronate work by inhibiting the activity of osteoclasts, the cells responsible for bone resorption. By slowing down this process, bisphosphonates help to preserve bone density and reduce fracture risk. These drugs are often taken orally, though intravenous options are also available for people who cannot tolerate oral medications. Now, while bisphosphonates are generally effective, they do come with some potential side effects. Long term use may lead to complications such as osteonecrosis or atypical femur fractures. So, treatment duration and monitoring are very critical. Next is hormone therapy, particularly for postmenopausal women. Since estrogen plays a significant role in maintaining bone density, the drop in estrogen levels after menopause accelerates bone loss. Hormone replacement therapy can help mitigating this loss by supplementing estrogen, which helps to maintain bone density. However, hormone therapy is not suitable for everyone, as it may increase the risk of breast cancer, heart disease, or stroke in some individuals. It is important for patients and their doctors to carefully weigh the benefits and risks. Now, let's talk about some of the newer agents for osteoporosis, which are becoming increasingly important in clinical practice. Denosumab is a monoclonal antibody that works by targeting a protein involved in the formation and activity of osteoclasts. By reducing the activity of these cells, denosumab slows down bone resorption and helps to improve bone mass. It is administered via injections every 6 months and has been shown to be effective in reducing fractures. Teriparatide is a synthetic form of parathyroid hormone that actually stimulates bone formation. Unlike most osteoporosis drugs that focus on preventing bone loss, teriparatide helps to build new bone. It is often reserved for patients with severe osteoporosis or those who have failed other treatments. However, it is only approved for short term use, typically up to 2 years due to concerns about long term safety. Both denosumab and teriparatide represent significant advances in osteoporosis treatment, offering options for patients who may not respond to traditional therapies. While medications play a key role in managing osteoporosis, they're often most effective when combined with non pharmacological approaches like rehabilitation and physical therapy. Physical therapy helps individuals maintain or improve their strength, balance, and coordination, which is essential for preventing falls. Exercises may focus on improving posture, enhancing muscle strength around the spine and hips, and encouraging proper gait to minimize the risk of falls. For individuals who have experienced fractures, rehabilitation is hyper essential. This may include not only physical therapy but also occupational therapy, which helps patients to learn how to modify their homes and daily activities to reduce the risk of falls or further injury. Occupational therapists may recommend using assistive devices like grab bars or walkers and making home modifications to improve safety and functionality. While we often focus on the physical aspects of osteoporosis, we cannot ignore its psychological impact. For many individuals with osteoporosis, the fear of falling can be overwhelming. This fear may lead to anxiety, social isolation, and reduced activity levels, which ironically can further weaken bones and increase the risk of falls. For patients, it is important to recognize that this fear is common but manageable. Working with a mental health professional or joining support groups can provide valuable emotional support and coping strategies. Mindfulness and cognitive behavioral therapy, CBT, have shown to be effective in reducing anxiety related to fall risk. Finally, the management of osteoporosis benefits from a multidisciplinary approach. In addition to your primary care physician, you might have to work with endocrinologists, rheumatologists, orthopedic surgeons, physical therapists, and occupational therapists. Dietitians may also play a key role helping you ensure you're getting enough nutrients to support bone health. While these might be considered a little heavy on the pocket, there is no replacement for a genuine medical advice from a healthcare professional. Yes, there are enough resources available on the internet for your research, but they're not the best for you to self diagnose your condition or even start treatment by your own self. You need to consult a healthcare professional as soon as you see any symptoms. By working together, this team of experts can tailor your treatment to your specific needs, ensuring you receive the most comprehensive and effective care possible. Now, there is an impact of eating disorders on your bone health as well. Eating disorders, particularly like anorexia and bulimia, are known to have devastating effects on bone health. The restriction of calories, along with hormonal imbalances, can lead to severe osteoporosis even at a young age. Women and men with anorexia often experience hormonal disturbances, including a lack of estrogen or testosterone, which accelerates bone loss. Malnutrition also leads to calcium and vitamin D deficiencies, further weakening bones. In fact, individuals with anorexia can experience bone loss rates comparable to those of postmenopausal women. Now, while bulimia may not cause the same extent of bone loss as anorexia, it can still affect bone health due to nutrient malabsorption and electrolyte imbalances caused by purging behaviors. Over time, this can lead to fragile bones and an increased risk of fractures. Now, treatment of osteoporosis in individuals with eating disorders require a multidisciplinary approach. Addressing the underlying eating disorder is the first priority, but bone health must also be managed with calcium and vitamin D supplementation along with potential hormone therapy. Weight restoration and normalization of menstrual function in women can help reverse some of the bone loss, though early detection is key to preventing permanent damage. Now, as we wrap this episode up on osteoporosis, it is essential to look forward at what is on the horizon. Future research and innovations in treatment could completely transform how we prevent, diagnose, and manage this condition. Current treatments for osteoporosis, such as bisphosphonates and denosumab, have proven effective for many individuals. But new pharmacotherapies are emerging that offer greater precision and fewer side effects. Drugs like teriparatide and abolaparatide represent a shift towards anabolic or bone building therapies rather than simply preventing further bone loss. These agents work by stimulating osteoblasts, the cells which are responsible for bone formation, to actively build bone, while currently reserved for severe osteoporosis cases. Future research could make anabolic therapies a first line option for a wider range of patients. While selective estrogen receptor modulators or SERMs like raloxifene are already used in certain populations, continued research into this class of drugs may reveal more precise applications for individuals with specific risk profiles, especially postmenopausal women. One of the most exciting areas of osteoporosis research lies in personalized medicine. By using genetic testing or identifying biomarkers, doctors can tailor osteoporosis treatment to the individual's unique genetic makeup and biological characteristics. Research has identified multiple genetic markers that influence bone density and the risk of osteoporosis. Now, as genetic testing becomes more accessible, these markers may help predict an individual's likelihood of developing osteoporosis and guide early intervention strategies. Now, in the realm of stem cell research, scientists are working on mesenchymal stem cells to promote bone regeneration. These stem cells have the potential to differentiate into osteoblasts, the cells that build bone. While still in experimental stages, the use of stem cells to repair or replace damaged bone tissue could be a game changer for osteoporosis treatment, particularly in individuals with severe bone loss. Gene therapy offers the possibility of correcting the genetic factors that contribute to osteoporosis by targeting genes involved in bone metabolism. Researchers hope to create treatments that could slow down or even reverse the progression of osteoporosis. This approach is particularly promising for individuals with genetic predispositions to the disease. Now, while the importance of calcium and vitamin D is well known, researchers are now looking at other dietary components that may influence bone health, such as vitamin K, magnesium, and protein intake. Future guidelines may become more nuanced, recommending specific combinations of nutrients to optimize bone health at different life stages. Studies are exploring now that how different types of exercises, such as resistance training, high impact sports, or yoga, impact on bone density. As research continues, we may see more personalized exercise recommendations that take into account an individual's age, bone density, and fitness levels. Now, before we close today's episode, let's go over some of the key takeaways for maintaining strong, healthy bones. Bone health isn't something you can put off until later in your life. It is a lifelong responsibility, and taking the right steps now can help prevent osteoporosis down the line. Here are some actionable steps you can start implementing today. As we've discussed, calcium and vitamin D are critical for maintaining bone strength. Remember, aim for 1,000 to 1,200 milligrams of calcium per day from dietary sources like dairy products, leafy greens, and fortified foods. Ensure you're getting enough vitamin D through safe sun exposure and supplements if necessary. Around 600 to 800 IU daily is recommended. Ensure you're getting enough vitamin D through safe sun exposure and supplements if necessary. Around 600 to 800 IU daily is recommended, but it's always best to check with your doctor for personalized advice. Do not underestimate the power of exercise in building and maintaining bone density. Engaging weight bearing activities like walking, hiking, or dancing at least like 3 to 4 times a week. Include strength training exercises that focus on major muscle groups as stronger muscles help to support and protect your bones. Avoid smoking and limit alcohol intake to help preserve your bone density. These habits can accelerate bone loss and increase your risk of fractures. One of the most effective ways to reduce your fracture risk is to prevent falls. Make sure your home is fall proof by securing loose carpets, improve the lighting around your house, and installing grab bars wherever necessary. If you feel unsteady on your feet, consider balance training exercises like yoga or Tai Chi to improve stability. Finally, make sure you're proactive about checking in on your bone health. Get a bone mineral density or a BMD test if you're at risk for osteoporosis, especially if you're postmenopausal or have other risk factors. Talk about your healthcare provider about osteoporosis screenings and treatment options if necessary. The sooner you identify these concerns, the more effective the treatment can be. Now, bone health is not just an individual concern. It is something we should all be talking about as families and communities. Encourage open conversations about osteoporosis with your loved ones. This is especially important if you have elderly parents or younger family members who may not realize how important bone health actually is. Now, by making bone health a priority, we can work together to prevent fractures and maintain the quality of life as we age. In today's episode, we've covered the structure of bones, how osteoporosis develops, and the importance of prevention and treatment. We've discussed a lot, to be honest. Remember, osteoporosis may be a silent disease, but it does not have to catch you by surprise. By being proactive with your nutrition, exercise, and regular health checkups, you can significantly reduce your risk. Make bone health a priority in your daily routine and an important topic of discussion with your loved ones. As you go about your week, take some time to think about how you can incorporate these steps into your life. Whether it is making small adjustments to your diet, starting a new exercise routine, or having a conversation with your doctor about osteoporosis screenings. Every single step counts. Thank you for tuning in to this episode of the Dr. Washprin's podcast, where we're making health a dinner table conversation. Stay healthy, stay proactive, and keep your bones strong.